So a medical home is not a place. It's a relationship with a primary care practice, a place where you go to get coordinated, comprehensive, accessible, family-centered care.
It means a doctor who's willing to coordinate all the different medical needs through specialists, forms, reports, sharing information, and best of all, somebody that you didn't have to re-explain every time you walk in the door.
So a benefit of a medical home is that it's a planned relationship. It tries to anticipate what your needs are and helps to meet those needs. Someplace where everybody knows you and tries to help you. A place that helps to coordinate the care that you get with specialists and with community resources. And there's lots of barriers for doctors in providing a medical home. So one of the biggest barriers is lack of education. So doctors aren't necessarily trained in how to be a good medical home. Another problem is time. So doctors feel a lot of pressure to see a lot of patients to get everybody's needs met. And so they don't always have the time to spend with kids who need a little bit extra time. And then reimbursement. So doctors are on a lot of pressure to run a business, and it can be difficult to spend enough time with the patient if you're kind of feeling that business crunch.
Some doctors simply are not willing to be a medical home or to do the work that's needed. However, I want to encourage you because there are many doctors who do. To encourage my physician to become a medical home, I ask them, what can I do to make your job easier?
I think you go to your most trusted medical professional, whoever that might be. So that might be the neurologist, it might be the general practitioner, it might be an eye specialist, whatever, and say, we really need coordination here. And we need somebody that will be open to us, take our phone calls, listen to us, work with us closely.
So most families find doctors or good medical homes in a couple of ways. So one is making sure that you're connected with other parents of children with disabilities. So know who has a reputation in your community, in your neighborhood, for providing good medical care for children with special health care needs and who's not afraid to provide that kind of care. And then second is working with your insurance company. So insurance companies have a rough sense of who's available, who's comfortable dealing with special health care needs because they get that information when doctors provide bills.
I just had this feeling that I didn't know how to help Will and how to build in some kind of structure or method for keeping on top of these crisis issues and this chronic medical issue. So I feel like the medical home has given us a safety net